Hi, my name is Fumi Ulam, and I am the CEO of Eli Health. And my professional background is in technology, so I've worked for various software companies over the past 20 years, before tech became cool. When my son Eli was 2 weeks old, he was diagnosed with sickle cell. He's now 12. And over the years, we've realized the challenges associated with managing sickle cell as a condition. We were going through a particularly tough time as a family, managing basic things like the school run, but also having to manage his medication and making sure that he's hydrated and he's taking the right steps towards managing his health. So we came up with this idea, which was to provide him with the goals, but then say, right, Eli, if you drink enough water every day, at the end of the week, you will get Roblox, for example. And we realized that that made the big difference, and it changed his behavior towards his health and the things that he had to do. So that's how the Eli app began, basically on a piece of paper in a chart. I realized that I could take this effectively piece of paper chart and make this into an app. And I began looking at how this would look and how it would change our lives. A particular moment that I do remember is being in hospital with my son. He was admitted with a sickle cell crisis, and he'd been in for over a week, coming up to 2 weeks. And in that moment, I would map out what I wanted the app to look like. And I remember talking to the hematology team and saying, look, we could do things so much better. There's so much more information. There's a lot of data that we're living with that you don't know. How can we make this app? This would be amazing. And I remember just wanting them to listen to me and to build this thing with me. But I understood in that moment that they're clinicians and they have lots of things to do, lots of patients to see. And we weren't the only people on their list. And I felt frustrated that I had this idea, but there was nowhere to take this idea and grow the idea. So when I heard about the Clinical Entrepreneur Program for patients, I realized that this was my opportunity. The Clinical Entrepreneur Program, number one, I'd say it's given us validation for our idea. Secondly, it's given us a community. People say you found your tribe, but I really feel like I have, by working with innovators that are also building solutions to tackle health problems. That's incredible. The third thing is the opportunities that come from being part of this program, the people that we meet, the organizations that are very interested in transforming healthcare. And I think that covers so many different things like branding, like funding, like building a product, like market research. We learn about that in such an amount of detail with professionals, with people that are still building, with people that have been successful. So you get to see and hear the highs and the lows of the journey. So far, we have built an MVP and that's live. And last week we demoed that to a clinician and had excellent feedback. So we now want to expand on what we've built and incorporate further functionality.
Living with sickle cell can be very challenging. So each and every tool to help us along the way is a huge blessing. I'm particularly keen on using the app. Eli app will be able to provide that bridge so that people can interact and communicate, so that together we can share experiences, share tips, help each other along the way.
I would highly recommend that if you are a patient, that you come forward and apply for this program, because you are a piece of the jigsaw that is missing in building innovations for healthcare, particularly if you are seeing inequalities or if you're having frustrations around how something could be better. Then I think it's definitely your, I wouldn't say responsibility, but I think you have the opportunity to actually be part of a solution.